We have developed 2 medically fit for discharge wards. The reason for doing this is so we get the right journey for our patients. They receive care from a range of people from the multidisciplinary team: physiotherapists, occupational therapists, nurses, pharmacists, all with a view to take our patients on the final bit of their journey back out into the community, where hopefully they will stay and not need to come back in to our A&E department and follow the same journey again.
Being a patient on a ward full of really sick acute patients when you're medically fit, it can be the most awful place to be. You know that you're not the top priority when there's really sick patients next to you. And because of that, Sandwell and West Birmingham hospitals invested into 2 medically fit for discharge wards to enhance the patient journey and to let them know that they are a priority and they do matter regardless of the delay in discharging them.
If you can imagine, some of the patients that come to medically fit for discharge have been on an acute medical ward for several weeks. So they come to Eliza Tinsley ward. It's a relaxing environment. They've got the opportunity to look out the window and appreciate the wildlife that we're very lucky to have.
Here at Spiral Health, we've developed a patient journey which supports an individual throughout their stay with us. It starts before they arrive with us. We actually send an assessor out to meet with them, to start the initial assessment and develop a profile with them about them. So it's looking at what's important to them, what hobbies, what interests they are. That continues when they arrive with us, so they're greeted by their name on arrival and they're shown to their room. The assessment continues, the profile continues, so we have a 1-page profile about them and how staff can best support them whilst they're with us. We're really proud to be nominated and we thank you very much for that.
Nominated by Nikki Petit, Teenage Cancer Trust lead nurse after it was suggested by 2 patients. The Teenage and Young Adult Service at University Hospitals Birmingham NHS Foundation Trust follows a principle of young person first, cancer diagnosis second. In its 11-bedded ward and 2-chair day unit, the service offers a home-from-home environment with open visiting, free Wi-Fi, a mobiles-on policy and extensive IT facilities. The service flexes patient care, including admissions and treatments around 21st birthday parties, school proms and other major milestones in young people's lives.
In September 2012, we launched a programme called Barbara's Story, a very powerful film that was aimed at training all of our workforce, 13,000 staff, on the needs of our most vulnerable patients, our older patients and those with dementia.
It's been the most important thing I've been involved with since in medicine, and having elderly parents with very great health needs and who are very frightened, I hope this can be rolled out to other healthcare institutions and other hospitals because it really makes a difference.
The film has taken off nationally. We've been able to fund it and it's been launched into a training programme which is free across the NHS voluntary sector, social care, and it's also rolling out internationally.
We came into post in January 2013 and I've been established for just over a year now.
We recognise the need to set up a bereavement team because bereaved parents, they require more support both emotionally and physically at such a tragic time in their lives.
We visit the parents on a daily basis on the delivery unit, and sometimes that can be before, during or after the birth of their stillborn baby. We offer them support by continuity from either myself or Emma on a daily basis. We then continue this support through trying to create everlasting memories of their limited time with their baby and helping them with things like blessing the baby, choosing memory items, clothing their baby, bathing their baby, and obviously liaising with other family members to create as much of an impact as we can.
So we're absolutely delighted to have been shortlisted for the Compassion Award because we feel that compassion is the whole reason that we developed this post and this role in the first place.
My name's Jane Anderson. I'm a consultant physician based at Homerton University Hospital. I specialise in looking after people with HIV infection, which is what we do here in the Jonathan Mann Centre.
In this clinic we provide HIV care for people living with and affected by HIV across London and further. And people come here to get support with their health and social care needs. So we work in an integrated model. We work very, very closely with the voluntary sector to provide services across a variety of needs.
Joined up, holistic, compassionate care for people with HIV is a real team effort, and that's why I've nominated the Jonathan Mann Centre team, because it's a completely holistic package of care here, and that means that everybody has to work together and bring a really amazing array of skills to bear to make sure that we actually deliver what people need to make the most of their lives.